Well, our medical advisory group has discussed a number of metrics that the school should consider in both enabling students to be on campus and making decisions about when and if they should adjust that stance. And the obvious metrics have to do with the number of cases that are in our community and that are in our school community in particular. But there are also, as important as that is, there are also some important other considerations, and the steps the school has taken to put dividers up between students, to limit the size and the number of cohorts that a student or a faculty member or another school administrator would be exposed to, and to keep those cohorts together for safety and security are all important. I've been quite impressed with both thinking about general metrics and recognizing that in our community we are fortunate to have more space and in some settings more resources to make sure that students can be safe and faculty can be safe, and they're going about that with a lot of focus and intention.
So there are many different ways of measuring whether or not it's safe to reopen communities, and of course ways to determine how safe it is to reopen the Sidwell community. First and foremost, one metric that we have to follow and monitor is what's happening in our local communities. And so watching what's happening with the virus in DC, in Maryland, and Virginia is of utmost importance. And following the guidance and the guidelines that those local health departments issue is also really important. We need to have a sense that the virus is being controlled, that the spread is slowing, that we're not seeing large outbreaks before we can think about safely and effectively reopening the Sidwell community or really any other school community. Another metric that's extremely important is the willingness of our faculty and teachers and staff and administration to come back to school, as well as the willingness and the acceptability of reopening school amongst the parent population. So that's another metric that we really need to monitor. And then another metric that's extremely important is making sure that the school has the resources and the equipment to be able to open safely and effectively. So are there measures in place to be able to socially distance, to enforce mask wearing, to make sure that we can monitor children and other people working in the school for any symptoms of COVID-19? So all of those combined metrics are really important as we think about a safe reopening process.
There are several metrics that many of us who are deeply involved in COVID-19 management follow, but there's three that really do stand out. The first is the overall incidence per 100,000 population. There's been pretty extensive studies done within the US that would actually show different ranges of low, intermediate, and high risk as a reflection of community spread. Certainly in the higher risk category, which Sidwell would watch closely, there would be greater risk associated with bringing students back onto campus. So the first metric would be the number of cases per 100,000. The second metric, which we watch closely, is the number of positive cases that are actually measured as a percentile. So for instance, within the state of Maryland, the average percentile positive rate is run between 4.5 and 5%. So these kinds of metrics are also utilized because it becomes important recognizing that percentile rates at the peak of the pandemic rose anywhere from 25 to 30% positive for the entire population being tested. The third metric that's also utilized is really more related to severity. What's the overall number of individuals being hospitalized for COVID-19? Those three metrics, in addition to others, and there's lagging metrics such as mortality, which is less useful in terms of our interpretation, but those metrics, when we look at 3-day and 7-day run rates, are they going up? Are they going down? Have they flattened and plateaued? All become really important in the decision making for when and how we bring students back onto campus.